In this next segment, we're going to be focusing on matters of physical health. Earlier, I did mention that generally men do not prioritize their health, whether we're talking physical health or we're talking mental health. Now, when one looks at the top 15 leading causes, of health challenges amongst males, at least 14 out of the 15 are physical health challenges. But in that, the fourth commonest problem, which is in the top five, is depression and suicide. However, this segment is focusing only on physical health. And I think, let me just unpack some of these issues. Issues relating to the cardiovascular disease is the leading men's health threat. Here we're talking problems with high blood pressure, problems with diabetes, problems with cholesterol, problems which, if not attended to, will lead to heart attacks, will lead to strokes. The second common issue is lung cancer, which is a big health threat to men. And it's lifestyle related, from smoking largely. Yes, you can have other cancers that have to do with exposure, especially for people who are in the mining sector. But here we're talking about lung cancers arising from a habit, a lifestyle, which is smoking.
Yeah.
The third one is prostate cancer, which is a leading cancer for men globally, and also here in South Africa. Is the most common cancer affecting men. I mentioned the depression and suicide, but that's on the mental health side. Diabetes mellitus, I've already mentioned, especially the one that people get in adulthood as a result of being overweight or obese. Umka, where we accumulate a lot of fat around our stomachs, and that creates a problem whereby we cannot control our blood sugar well. Erectile dysfunction, that's a physical health problem, a common problem. By this I mean the inability of a man to have an erection, or inability of a man to sustain an erection. In fact, where I come from, in the Eastern Cape, when we greet a gentleman, another person, we don't say, how are you? Sometimes we say, isavuka. Does it still wake up? Because you know what? It is the best indicator of one's health. The ability to have an erection or to sustain an erection. Because if you've got diabetes or you've got high blood pressure, it will most commonly, show itself, by the inability of the male equipment to say viva.
Doc, sorry to interject there. I was reading an article not so long ago where there were new diagnoses around diabetes type B. I think that this has to do with lifestyle related.
Yes, that's type 2.
Yeah, type 2, yes. You would correct me medically. Yes. But the article was actually raising awareness amongst young adults. I would say around from mid-20s to 40s. That's where the detection is.
Yes.
So which really tells me that, especially because the number was high on men as well, which tells me that we as men, we really have not taken care of us in a long time. And primarily, these are the things that we need to do those health checkups, It can be early, it can be, regardless of...
Yes. Let me just continue, quickly finish these other ones. So, erectile dysfunction is one of the commonest indicator of physical health challenge. And these are physical health challenges that are arising from lifestyle. Liver disease or liver cirrhosis, where the liver has been bent by, the regular intake or binging of alcohol.
Yeah.
So the liver gets to be bent.
Yeah.
Colon cancer, that is cancer of the large bowel, very common as well, and it's an increasing problem amongst black men. Pancreatic cancer, cancer of the gland that actually is supposed to produce, insulin that regulates sugar, causing what we actually call type C diabetes. Because obviously, when the pancreas cannot work, then you cannot regulate sugar.
Yeah.
It's a very aggressive type of cancer. Within 12 to 18 months of diagnosis, usually you're gone. HIV and AIDS, it's a lifestyle issue. It has to do with men adopting preventative measures
Yeah.
like protected sexual intercourse, gout, which is a common problem
Yeah.
amongst men, resulting from high intake of red meat, especially if it's combined with alcohol. So after the braai, alcohol use disorder. A lot of males, they suffer from challenges of alcohol use disorder. And we'll talk about this later, that males, when they are stressed, they actually escape to alcohol.
Yeah.
And sometimes they get to a point where they are addicted,
Yeah.
to alcohol. Chronic obstructive airways disease, which is problems with the lungs arising from smoking. All right?
Yeah.
Unintentional injuries and accidents, because we tend to have riskier lives. And lastly, we spend too much time outside as males, and therefore our chances of getting skin cancers or what we call melanoma tends to be high. So I've given you just this overview.
Yeah.
Now, having given you this overview of the physical health challenges amongst men,
Yeah.
I think the message that we need to be able to communicate to males is that the old adage of prevention is better than cure.
Yeah.
Yeah.
Yeah?
Yeah.
Prevention is better than cure. Most of these conditions I've mentioned can be prevented.
Yeah.
Yet, as males, we don't prioritize prevention.
Yeah.
But if at least you cannot prevent, the next thing is early detection.
Yeah.
Because early detection saves lives.
Yeah.
And once you are diagnosed, you need to be able to focus, on adhering
Yeah.
to treatment.
Yeah.
All right. So this is just physical health, and whether we're talking prostate
Yeah.
or we're talking colon cancer, early detection,
Yeah.
very important.
Yeah.
Now, I just want to pose a question to you guys.
Yeah.
I mentioned that prostate cancer is the most common cancer amongst males in South Africa and worldwide. Tato, have you ever gone to actually have your prostate checked? Because we're seeing more younger and younger people who are presenting with prostate. Have you ever gone to see a doctor to have your prostate checked?
Thank you, Doc, for the question. Honestly, I haven't went to check. I haven't went for the checkup
Yes.
in my life.
Reason?
Firstly was also I didn't know much about it,
Yes.
and I didn't know that it's so important for me to actually do the checkups.
Yeah.
And now that you are also, mentioning it, it becomes an alarm to me to say this is very important. As you mentioned, that it's better to check earlier, so that if there's anything that's coming out, there's anything alarming, then we can prevent earlier.
Yes.
Yes.
All right, Sizwe, as a man who is 30 plus, have you ever gone to check your prostate?
I've never gone to check for prostate, doc. I don't have valid reasons why I haven't, but also I think stereotypes amongst those kind of medical checkups is like, I'm from KwaZulu.
Yeah.
Those things are not for Zulu people, for example.
Yeah.
You understand? Just making an example. So it's something that I've never considered as most important thing in amongst the checkups that we do as men. So I think most of us men, I'll just generalize, we do have that stereotype kind of perception that no, it's not for me, it's for other people to check. Yeah.
All right. So now let me just unpack a bit.
Yeah.
Yes, let me just unpack a bit. So when, like I said, prostate cancer is the most common cancer affecting males. We encourage males to actually go for an annual checkup to check, if there is any enlargement or abnormality of the prostate. Yeah.
Yeah.
So when you come and see me as a doctor,
Yeah.
when you come and see me as a doctor, one, obviously, I take history
Yeah.
to check, if you've got any family background, because sometimes it does go in families, and it's
Yeah.
more common amongst men of African descent, compared to any other, racial grouping. Yeah.
Okay.
So I'll take your history. The second thing, after examining you, I will ask that I put a finger uh, through your anus to try and feel the
Yeah.
consistency and the size of the prostate. Now, when I was asking you any particular reason why you have not had the test, I thought you guys would say it's because you are uncomfortable about the possibility of somebody putting a finger up your anus to feel the rectum. But obviously, I was wrong in thinking about that. But now that I've told you, how comfortable would you be in actually going and getting a test done whereby the doctor puts a finger through your anus to try and feel the rectum?
Hey, that's a difficult one, Doc, because still, as you are mentioning and you are unpacking everything and the importance of this prostate cancer test, I'm still uncomfortable in my mind to go.
Inkinga yini baba?
Inkinga
What's the
nje ukuthi
problem?
umuntu afake umunwe ngemuva kumina. That's the only problem. I think it goes back to that thing I
Yena
mentioned
uzithembi yini baba?
of stereotype. No, ngiyasithemba, but I'm not even comfortable, myself, in this kanjalo. So it goes back to stereotypes and ukuthi, hey, this is izinto zabanye abantu, not us as men. Yeah.
Let me go to
Yeah.
Tatu. How comfortable, now that I've told you that it's important to screen for the commonest cancer amongst male, which is prostate cancer, how comfortable are you to go in to see your family doctor and have a finger being put through your anus to feel your rectum?
That's a very tricky question, Doc, because personally, it's one of the beliefs that a person have, that nothing should go back, should go there underneath there.
What do you
that's
mean? What do you
like
mean?
nothing.
What do you mean a belief?
It's just a belief that I made for myself, like it's a thought that I actually built for myself that no, it's one way. So I'm using that part only when I'm in the bathroom, and then
Yeah.
that's it.
Yeah.
So now when you mentioning this, and I understand the importance of it, but it's just so uncomfortable because of
But how can it be uncomfortable when you've never done it?
just to think about it. Just to
Okay.
think about it.
All right. But anyway, so when I qualified, which is
Yeah.
35 years ago,
Yeah.
that was the main screening method
Yeah.
for prostate cancer at my surgery. Nowadays, we have what we call PSA test, prostate specific antigen test, whereby you get a little prick and then we put it on something like the test for pregnancy.
Yeah.
And when there are two lines, then we know that
Okay.
your PSA, which is produced largely by the prostate cells, is high, which might be an indication,
Yeah.
of prostate cancer. But that test must always be read together with the rectal examination. Yeah. When you go and see urologist, which is a specialist now, then they have got an ultrasound, a scan, that can be put through the same hole that we are scared of it being, penetrated, so that they can look at the consistency of the prostate. Yeah. And if they pick up something there, then they take a biopsy. That is a piece, send it to the lab and see if there are any cells. So I think the key message here is for all physical health issues,
Yeah.
it's important once a year to go and be checked.
Yeah.
Because many of these do not show themselves, and by the time they show themselves, it's already too late.
Yeah.
That applies to prostate cancer, that applies to diabetes, that applies to high blood pressure, that applies to all of these. And these
diseases.
are non-communicable diseases,
Yeah.
which are largely modified by improvement in one's lifestyle. So the key message to the men of AXA is make it your business to go and be checked once a year for these non-communicable diseases and also the cancer like the prostate. And some of you who belong to medical aids like Discovery, you will get even more points, vitality points, if you actually go and get checked. So it's important. The key message is prevention is better than cure. And the key message is early detection saves lives. And once you have been put under treatment, please adhere to the treatment guidelines and have a good relationship with your treating practitioners. So I think at this moment we can maybe move on to the next topic, which is going to be about masculinity, toxic versus healthy masculinity.